Question number 1.
Nurse Mimi is providing an online lecture to a group of nursing students. She explained to the attendees that the most common type of kidney stone is made up of A. Struvite, B. Calcium and oxalate, C. Cysteine, D. Uric acid. The correct answer is letter B. Calcium oxalate. There are 4 major types of kidney stones. The most common type is calcium and oxalate. They are formed when there are high levels of calcium and oxalate in your bloodstream. These minerals are mainly found in nuts and grains. This type of stone is considered to be the hardest. Struvites. Struvites are known to be the less common type of kidney stone. They are formed as a result of urinary tract infection by urease-forming organisms. They grow rapidly and occupy the kidneys, causing obstruction. Cysteine stones are due to an inherited defect in the transport of the amino acid cysteine, leading to excessive excretion in the kidney. The saturation of cysteine in the kidney predisposes the development of stones. Uric acid stones are formed when the levels of uric acid in the urine are too high or the urine is too acidic on a regular basis. Other contributing factor is consuming high purine foods such as red meat, organ meats, and alcohols.
Question number 2.
Nurse Mimi tried to evaluate the learning of the students in the type of kidney stones. She asked which patient is at most risk for developing uric acid type kidney stones. A. A 55-year-old female with recurrent urinary tract infections. B. A 7-year-old male with cystinuria. C. A 53-year-old male with gout. D. A 30-year-old female that eats high amounts of spinach on a daily basis. The correct answer is letter C. Patients with gout experience high uric acid levels, which can lead to the development of uric acid kidney stones. In option A, the patient is at risk for struvite kidney stones. Option B is at risk for cysteine kidney stones, while option D is at risk for calcium oxalate stones.
Question number 3.
Michael was scheduled for an intravenous pyelogram (IVP) to assess for kidney stones. Which finding below warrant Nurse Mimi to contact the physician? A. Patient experience hematuria. B. Patient is allergic to shellfish. C. Patient reports flank pain that radiates downward. D. Patient has cloudy urine. The correct answer is letter B. During an intravenous pyelogram, a special dye which is iodine-based will be given through an IV. Then X-ray images will be taken to assess the kidneys, bladder, ureters, and urethra. If the patient is allergic to shellfish, then most likely he is also allergic to iodine that will be used during the procedure.
Question number 4.
The doctor orders a 24-hour urine collection to patient Michael with recurrent kidney stones. As the nurse, you know that the specimen should be A. Kept at room temperature. B. Kept on ice or refrigerated. C. Sent to the lab every 4 hours. D. Kept at a temperature between 98.6 Fahrenheit to 99.3 Fahrenheit. The correct answer is letter B. 24-hour urine collection specimens should be kept refrigerated or on ice bath to preserve its contents. If specimen is not kept cold, it can alter the test results.
Question number 5.
Michael, with a uric acid kidney stone that is 1.8 millimeters in size per diagnostic imaging. He is having severe pain and rates their pain 10 on 1 to 10 scale. The physician has ordered a treatment plan to assist the patient in passing the kidney stone. What nursing intervention is priority for this patient on the scenario? A. Administer pain medication. B. Encourage fluid intake of 2 to 4 liters per day. C. Implement a high-protein diet. D. Massage the costo-vertebral area. The correct answer is letter A. Controlling the patient's pain is the priority intervention for this scenario. Some doctors would even prescribe morphine to alleviate pain of the client. Fluid intake is encouraged, but not at this moment. A high-protein diet will further increase uric acid levels, therefore, should be avoided. Also, you should never massage the costovertebral area as it would trigger more pain.
Question number 6.
Nurse Mimi is developing a nursing care plan for a patient with a kidney stone. Which of the following nursing interventions is considered vital in the patient's plan of care? A. Keep patient in supine position to alleviate pain. B. Restrict calcium intake. C. Strain urine with every void. D. Maintain fluid restriction of 1 to 2 liters per day. The correct answer is letter C. It is vital the nurse strains every void and assesses the urine very closely for stones. This is crucial so it can be determined what type of kidney stone is causing the problem. Therefore, appropriate treatment can be ordered.
Question number 7.
Your patient arrives back to their room after having extracorporeal shockwave lithotripsy, ESWL, for treatment of a kidney stone. What will be included in the patient's plan of care? Select all that apply. A. Encourage bed rest. B. Encourage fluid intake of 3 to 4 liters per day. C. Maintain nephrostomy tube. D. Strain urine. E. Keep dressing dry and intact. Extracorporeal shockwave lithotripsy, also known as ESWL, is a technique for treating stones in the kidney and other parts of the body that does not require surgical incision. Instead, high-energy shockwaves are passed through the body to break the stones into pieces, allowing it to pass through for excretion. Encouraging bed rest is not recommended as it will not promote movement of the stones, thus prohibits excretion. We should encourage ambulation to the client, making option A an incorrect statement. Encouraging fluid intake helps in facilitating movement of the stones as it will produce more urine that is excreted in the body, making option B a correct statement. Nephrostomy is a procedure to drain urine from your kidney using a catheter tube. This is performed when ureters are blocked and urine is unable to flow. This is not performed in extracorporeal shockwave lithotripsy, making option C an incorrect statement. It is vital that the nurse strains every void to assess the urine if stones has already passed out, making option D a correct statement. Keeping the dressing dry and intact is not applicable, as extracorporeal shockwave lithotripsy doesn't involve any incision, making option E an incorrect statement.
How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends.
You can provide support to the creator by giving donations so that he can create more videos like this. Please check the description below for more details.